Let's get started by learning some Medicare basics. So, you've probably heard that Medicare has 4 parts: A, B, C, and D. However, we actually prefer not to teach it this way because in our experience, people have the tendency to treat this like a shopping list. I have to get an A, a B, a C, and a D. No, quite frankly, that's not true because C is simply a repackaging of A, B, and D. So instead, we prefer to teach that Medicare has 3 parts: A, hospitalization, B, medical insurance, and D for drugs, and 2 distinct paths, 2 unique ways to get those 3 parts of Medicare. So let's take a look first at the parts of Medicare. First, we'll look at Part A. Part A is hospital insurance. This is the part of Medicare that is premium free for those who have paid Medicare taxes for 10 years, or for those who have a spouse that has paid for those 10 years. If you are ever hospitalized or in need of skilled nursing facilities or hospice services, this is the part of Medicare that will provide you with this coverage. And unfortunately, we are really not speaking here about assisted living facilities. So activities of daily living are not typically covered by Medicare. All right, onward. Now, there's also Medicare Part B. This is medical insurance, the part of Medicare that you will need to diagnose and treat medical conditions. This part of Medicare is considered optional, but if you do not enroll in this coverage, you may face late enrollment penalties later on. Part D. This is prescription drug coverage. It is coverage provided and administered by private insurance companies, not the U.S. government. This coverage helps to cover the cost of prescription medications in a plan's formulary. A drug formulary is essentially a catalog of medications that a plan will cover and how it covers them. It's important to note that a Part D plan helps to cover the cost of medications. In many cases, you will share in the cost of your prescription drugs through deductibles, co-pays, or co-insurances. It's also important to note that Part D plans do not cover over-the-counter medications, vitamins, other supplements. Now that we've discussed the basic parts of Medicare, let's talk about the 2 distinct paths or types of Medicare coverage. Most people, when they turn 65, have 2 path options available to them: Original Medicare or Medicare Advantage. Some people have extra path types, such as retiree coverage or military coverage options, but for today's session, we'll address the 2 main paths that most people face when they're about to turn 65. First, let's talk about the path of Original Medicare. This is Medicare administered by the U.S. government. That's why we've put a Capitol building in the background. When you choose this path, technically the U.S. government is in charge. You can see any provider who accepts Medicare, regardless of their location. Essentially, there are no networks. This means you can see providers while on vacation in sunny California or skiing the slopes of Colorado and receive the same coverage you would receive when you're at home. This path always starts with a person enrolling in Part A and Part B. Technically, you could stop right here and say, I'm enrolled in Medicare. Yes, technically that is true, but that can be a very expensive way to do Medicare. In fact, Part A has a $1,400 hospitalization deductible. Notice I said hospitalization deductible and not an annual deductible. You will essentially pay this every time you are hospitalized. And Part B has a 20% coinsurance on all healthcare services. 20% of every doctor's bill, every specialist's bill is your responsibility. And A and B by themselves have no out-of-pocket spending limit. So you could literally spend and spend and spend until you have nothing left. This is why for comprehensive coverage, you also add a Medigap policy provided by a private insurance company and a standalone Part D prescription drug plan. Once you put these two extra pieces in place, most, if sometimes not all, of the out-of-pocket costs inherent in A and B by itself can poof, go away. Now, let's talk a little bit more about what a Medigap policy is. Medigap policies are the same thing as Medicare supplements. It is coverage provided by a private insurance company. These policies cover those things that Medicare Part A and B typically do not cover, such as the $1,400 hospitalization deductible or the 20% coinsurance for healthcare services. With this coverage, you essentially pay one monthly premium, but then have few, if any, out-of-pocket costs when you use healthcare services. With a Medigap policy, you essentially never need to worry about Medicare Part A and B not having an out-of-pocket spending limit because you essentially do not have out-of-pocket costs with this coverage in place. Medigap policies have been standardized by the federal government into 10 plans, known by letters, such as Plan C or Plan F. Regardless of the insurance provider or the premium you pay for this coverage, each plan must provide the same benefits. So, for example, the Plan C you get from Mutual of Omaha will cover the exact same things from the Plan C you get from Humana. Finally, in order to get a Medigap policy with no medical questions asked, you must have a guaranteed issue right. Okay, so what is a guaranteed issue right? Well, essentially, this is a rule that ensures that you can get a Medigap policy with no medical questions asked. When you have a guaranteed issue right, insurance companies cannot deny you a policy or raise premiums based upon your medical history. You have a guaranteed issue right to get a Medigap policy for the first 6 months that you are 65 years or older and enrolled in Medicare Part B for the first time. Once both of these things are true, essentially a clock starts ticking until the expiration of your guaranteed issue right. After you lose your guaranteed issue right, insurance companies can put you through underwriting, ask you medical questions. If they find anything they do not like, they can deny you coverage, and you may not be able to get this coverage again in your lifetime. Now, there are some important states to note: New York, Connecticut, Massachusetts, and Maine. These 4 states give you the unique ability to still get a Medigap policy with no questions asked outside of the standard guaranteed issue right. Now let's take a closer look at the costs associated with the path of Original Medicare. Part A is premium free for those who have paid 40 quarters of Medicare taxes. Everyone enrolled in Part B, regardless of path, pays the Part B premium. Those enrolling in Medicare in 2019 will pay $135.50 per month. The price of a Medigap policy varies by company, zip code, age, type of plan, etc. A standalone Part D drug plan begins at about $15 per month and goes up from there. So thus, we've calculated the Medigap policy and Part D drug plan premiums to total $115 a month to over $400, which is untypical but is possible. Now let's talk about the other path of Medicare, known as Medicare Advantage. The first thing you'll notice is that there is no Capitol building in the background. Instead, we've put a corporate building. The reason why is that when you choose this path, this is Medicare administered by a private insurance company. On this path, the insurance company is in charge. They get to make the rules. And when you visit the doctor, you'll pull out an insurance card, not your Medicare card. Now, Medicare Advantage policies have to provide basic Part A and Part B services. But they changed the rules that you have to follow in order to get these services, and we'll talk about the rules in just a second. Plans on this path usually roll in Part D drug coverage as well. Then, to make these plans and this path as attractive as possible, these plans usually have very low or no monthly premiums. This is a huge selling point for Medicare Advantage plans. And they can add in extra benefits that typically original Medicare does not include: vision, hearing, dental, sometimes long-term care or safety handlebars, things like that. Now, the insurance company is going to basically take all 7 of these elements and mix them into a new package of Medicare known as an MAPD plan, Medicare Advantage with Part D drug coverage. This is what Medicare refers to as Part C, but as you can see, it is really much more of a path than a part. Remember, on the path of Medicare Advantage, you have to follow the rules of the insurance company. Here are some of the most basic rules. You have to see providers in a network. Legally, that network can change at any time, and if you go outside of the network, you may be completely on your own paying that bill. You are subject to prior authorization rules when you are on this path, meaning your doctor says, hey, you need surgery and then physical therapy. But before you can use surgery and physical therapy services, you have to get the insurance company to agree with your doctor and agree to be willing to pay for those services. And of course, every time you use healthcare services, you are responsible for paying any deductibles, co-pays, and co-insurances up to that plan's annual out-of-pocket spending limit. Now let's take a look at the costs on the path of Medicare Advantage. Once again, if you or your spouse has paid 40 quarters or 10 years of Medicare taxes, you'll receive Part A for free. And yes, you still do pay for Medicare Part B on the path of Medicare Advantage. Now, here's why your initial enrollment into Medicare is so vitally important. In 46 states, as soon as you make your path decision, you basically have to imagine that an earthquake happens behind you. Now, if you want to change paths, types of coverage, you're going to have to wait for a bridge. But bridges only show up at certain times of the year, and in order to cross, you have to follow the rules of the bridge. It's actually pretty simple to switch from original Medicare to Medicare Advantage. As long as you're doing it at the correct time of year, Medicare Advantage plans have to take you regardless of any pre-existing medical conditions. Here comes the problem. The problem is when people want to switch from Medicare Advantage to the path of original Medicare. They often think that they can get everything that's over there. But chances are you no longer have a guaranteed issue right to get a Medigap plan. And if you do not have that guaranteed issue right any longer, the insurance company can ask you medical questions. If they find anything they do not like, they can deny you that type of coverage altogether, which means if you were to continue to switch from Medicare Advantage to the path of original Medicare and cannot get a supplement, you are subject once again to all of the out-of-pocket costs inherent in Part A and Part B by itself, with no out-of-pocket spending limit. This is why we say people wind up getting stuck on the path of Medicare Advantage. Now let's talk about the states of New York, Connecticut, Massachusetts, and Maine. In those 4 states, essentially, the earthquake never happens. This means at age 65, when you're relatively healthier, you can head on the path of Medicare Advantage. Then, heaven forbid, you're diagnosed with cancer or Parkinson's 2 years later. You know you're going to need more healthcare services. So you go ahead and make the switch to the path of original Medicare, and you can still get a Medigap policy, no questions asked. Here are 2 things to keep in mind though. you can still only disenroll from a Medicare Advantage plan at certain times of the year. And in those 4 states, Medicare supplement plans, Medigap plans, can be about 10% to about 200% higher in premiums than the rest of the country.